So what is PRP and how does it work?
So PRP stands for platelet-rich plasma, and platelets are, people are familiar with platelets in whole blood, and their normal function being when you cut yourself, platelets are called to the site, you form a scab, you stop bleeding. PRP is sort of this idea where we take out or separate just the platelets from whole blood that we draw off you, and then we use just those platelets to re-inject into a certain spot of interest.
Right. And the key is the platelets bring growth factors with them. There's 12 to 14 different growth factors, which is really just a signaling mechanism to the rest of your body that there's an injury here, which is why when you cut yourself and you stop bleeding, which is what Rick was talking about, that's the first stop, right? The first part, you have to stop bleeding. But then you need to fix it so that you heal new skin there. So it sends a signal to the rest of your body, to your fibroblasts, to your skin, to make new collagen, new elastin, or whatever needs to be made to replace it. So that's how your bone heals when you break your bone. That's how your skin heals. That's how stuff heals in your body.
Okay, so what you're doing is basically telling your body, hey, there's this injury and we're gonna try and heal it faster by adding these platelets to this specific spot now.
Right. I mean, I think in addition to speed, I think it also highlights this idea that, when you get an injury, you're gonna heal to some degree. I think as we get older, not all injuries heal to 100%, right? It's almost like the body's saying, we're gonna put a Band-Aid on it, this is good enough. But you're still left with maybe a deficit. So in the application, or in terms of like a joint, like a partial rotator cuff that you partially tore or something like that, that might improve with physical therapy or just rest from not participating in whatever activity that maybe gave it to you. But using PRP, you sort of increase, now the idea is to repair some of that tear or injury.
Well, and the other key part is, right, so that if you tear your rotator cuff or you tear your hamstring, something like that, you're gonna bleed in that muscle, right? Which means there's platelets there, which means there's growth factor. Well, that's great, but your platelet concentration in your blood might be 300,000. But when we draw your blood, we spin it and we hyper concentrate the platelets, now we might have 12 million platelets, which means we have now, 1,000x your growth factor. So now when we inject that PRP right into the injury site, I'm bringing not one pallet of bricks, but I'm bringing the entire house worth of bricks to repair the wound.
Okay. I hear people say, I'm scared of needles. I'm scared of needles. Don't want to do it because I'm scared of needles.
Mm-hmm. I would say to that, getting a blood draw is very common. So, yes, you have to be able to tolerate a blood draw. And we use very specific needles when we do this type of stuff. In fact, we're using a derivative of what some of the sharpest needles in the world are. We order these special, and it's really minimal. We ultrasound guide this stuff. So, in terms of pain in a surgery, a surgical procedure is a lot more painful and has a lot more downtime associated with it than a short-term injection.
Yeah,
so.
If you had your rotator cuff and you had surgery,
right,
you're gonna have pain for at least 4 to 6 weeks post-operatively. During this, you're gonna have pain for about 8 seconds, and it's minimal from the needle poke, and then that's really kind of it.
Okay. And what about the effectiveness of this procedure?
Yeah, that's variable to some degree because it depends on how bad the injury is. So the data is pretty clear on this. If you're talking about, say, a knee joint, so you're an older person, you've got some arthritic changes in your knee. If you have mild to moderate osteoarthritis, the data on this says you will improve significantly. If you have profound osteoarthritis to the point where you're like a month away from a knee replacement, the data is not as clear. Some people get much, much better with this, and we've had those patients who get better. But then some people get a little better, but not enough to ultimately avoid a joint replacement. But it depends a little bit on how bad the problem is to start with.
Right, what your goals are. Are you trying to kick this can down the road? Are you looking to get some relief and maybe get back to some of the lifestyle things you were doing?
Yep.
And where it's really based around you and what your desires are for that.
Yeah.
Okay, so you might need more than one treatment.
Yeah, so we definitely find there are definitely places that say if we're gonna do it, you have to get 3 treatments. We don't really do it that way, but we do tell people that I expect I'm gonna have to treat you 2 or 3 times, but I wanna make sure you're getting some response after the first treatment. So if we can get you 30 to 40% better after the first injection, you're probably gonna be a good responder. And it's really gradations, like Rick was saying. If you get to the point where my rotator cuff's bothering you so much that I can't sleep at night, after that first injection, about 6 weeks post-injection, you can sleep at night now. You don't have pain anymore. It might still bother you when you bench press, but now that's what the next injection's for.
Right.
Don't you find that's how it works?
Yeah, absolutely. I mean, I tell exactly the same thing. Yeah, I mean, I tell people that there is a possibility to 2 to 3 injections, but let's see how you do in your first round, and we'll sort of make the decision together.
Yeah.
So let's say you've had that 2 or you've had that 3 and you're feeling really, really great. How long will that last?
Yeah.
Ideally, the idea is that we don't expect to see clients back, right? We want to meet you for your injury, but the treatment course is getting you to a place where you're healed. A lot of times, let's be honest, we will use physical therapy and some of those resources in the community to help accelerate healing. So when those things start working together, you get this great response. And if you can get people back to, where there's 95% intact tendon, well, they're going to feel pretty good. They're going to get back to weightlifting and making sure you don't re-injure yourself. That's the name of the game, always.
Yeah. That's the key. Is it will last as long as it lasts unless you injure it again. If you re-injure it, well, you re-injured it. Now we have to start fresh. The other thing is a lot of people are familiar with injections, but they get steroid injections. And steroid injections might take away the pain for a month or 2, but ultimately, long term, it's very detrimental to a joint and to a tendon or a ligament.
Right.
It will degrade it over time. So the more steroid injections you have, the shorter that it'll work for you and the more damage is being done. Whereas PRP is going to be a little uncomfortable for a week or 2 after the injection, but eventually it actually heals the problem as opposed to just covering up the pain.
Yeah, the other thing about PRP is that it doesn't at all preclude you from having the surgical procedure, right? So let's say you are on your way, and so and so has said you're going to need this joint replaced or you're going to need this tendon repaired. Well, even doing PRP, maybe you stave that off. Maybe you don't have to have the procedure done because you're just getting better and you're getting back to the things you want to do.
Right.